government fears that the holidays and the relaxed lockdown rules may soon trigger a fourth wave of COVID-19 infections. In the meantime, it's desperately trying to inject some life into the country's sluggish vaccination program. 250,000 people got the jab over the weekend thanks to government's Vuma vaccination drive. Over in the Eastern Cape, COVID-19 hospitalizations continue to drop. Well, we've got the Provincial Health Department's Kidwell Matshotyana on the line now to discuss their situation. Kidwell, thank you so much for joining us. A good morning to you. I know that Eastern Cape has had some really big problems when it comes to COVID-19, particularly over the holidays. What are you seeing right now with the numbers and some of your greatest concerns?
Great. Good morning, Naledi, and your viewers, and thank you for having us. Basically, I think for us in the Eastern Cape, really the numbers have been going down since the beginning or late September into October. And it's very comforting for us because the second wave has not been as brutal as the first and the second wave in the Eastern Cape. The concern obviously is, as part of our strategy as a province, as we prepare for the fourth wave, is to increase the vaccination numbers and have more people vaccinated, as well as also promote the use of non-pharmaceutical interventions. And lastly, to deal with the negative messaging around vaccination and even the issues, the stigma that is attached to COVID-19 infection, which we have seen in the past few months as a problem in our province.
Yeah. And how's that vaccination drive going then in the Eastern Cape?
Yeah. No, it's going well. It's going very well. As of our last reporting, we had vaccinated about 2.7 million of our residents. We enjoying great partnership with our private sector and non-governmental sectors in the province to increase vaccination. Our strategy really is to improve access and also equity. So we introduce different models where we go to people, we reduce the cost that people have to incur to access vaccination. And that has really been a success for our program in the Eastern Cape. The partnerships and also the need to ensure that we are able to access even the most hard-to-reach parts of the province with the vaccination program.
Yeah, unfortunately, what we're hearing from experts a lot these days is that a fourth wave is essentially inevitable, that it's coming. The question is just when it will arrive, which means that we really need to get a lot of prep work done with our health facilities. Where are you in terms of that?
So our strategy with the preparation for the fourth wave, we first understand that the response to COVID-19 is not just a Department of Health's responsibility. We are working with the leadership of the Office of the Premier, which coordinates all the sector departments and also the non-governmental and private sectors. Our priority, as I've mentioned earlier, is the vaccination program, rollout of the vaccination, targeting those that are most at risk for severe COVID infection. So the 50-plus age group is our priority, and those people that have comorbidities. Fortunately, we are rolling out the Sisonke booster dose as well. So together with protecting the general public, those that are at risk, and also our health workers, we are putting that as the first strategy. The second area of our focus is on the essential health programs. Over the first and the second wave, we have been looking mostly at how to respond to COVID and in a way neglecting the other health programs. So we have now looked at a system where we integrate COVID-19 into the other health programs as part of our public health response. Thirdly, the hospitals themselves. We have built capacity in our hospitals over the past few waves, first and second wave, and even in the third wave. So we are investing and continue to invest in ensuring that we have adequate beds, we have oxygen supply, we have the pharmaceutical, the medicine, and PPE in adequate supply at all our facilities.
Yeah, I mean, the work is...
And I wouldn't...
I'll let you finish that thought, but let me just jump in there and you can add that thought to one last question. Sorry about that. But as we encourage people to go and get vaccinated, there's also the work, surely, that has to be done to remind people to just adhere to COVID-19 regulations, right? Like wearing masks, social distancing. Have we lost that? Like, have we become lax with that? And do we need to remold those attitudes again?
Yes, I think there's still a lot of work that needs to be done, and that's where our risk communication and community engagement program or area of intervention focuses on, to help people or remind people about the basics of preventing COVID-19 infections. And we have great partnerships with our local municipality in environmental health and health promotion areas. But generally, there's a lot of laxity that we are seeing, and it is a concern because we are a tourism province around the festive season. So we do want to, and we have set up plans to ensure that we put systems in place to encourage the compliance with regulations and the use of non-pharmaceutical interventions.
Yeah, well, thank you so much for speaking to us. We really do appreciate it. That there, Eastern Cape Health Department's Kidwell Matshotyana speaking to us. And of course, that's a reminder that while the numbers have come down, the virus hasn't gone anywhere. So we need to get vaccinated and, of course, adhere to COVID-19 protocols.